Well, their main goal is to keep San Antonio heart healthy. I went to Schnitzler Cardiovascular Consultants, where I met one doctor whose expertise is also treating San Antonians effectively. Well, I'm sure this place looks familiar to you. We were here not too long ago at SA Wellness Institute. They are on the same floor as Schnitzler Cardiovascular Consultants, and they're teaming up to make sure that San Antonians stay healthy. Maria Christina, how are you?
Welcome.
Yes, it's good to be back. And last time we were here, we talked about SA Wellness Institute. Now you want to talk about SCC and a brand new member of your team. Tell us about her.
Dr. Shivadeva Pita, who comes to us from the Mayo Clinic. Dr. Schnitzler sees an array of patients, 16,000 to be exact, of which are basic blood hypertension to coronary artery disease. And Dr. Schnitzler was looking for a physician that had training in the more advanced procedures, because we do have a lot of very complicated patients. Dr. Pita is able to do a heart cath and go in and do a dilatation, where you go in with a balloon catheter if you have an obstruction in an artery, or if not, you go in with a stent, which is a little device that opens that artery. By the same token, people that have coronary artery disease are also going to have it sometimes in their carotids or in their legs or in their stomach or in their kidneys. And she's able to go in additionally and put a stent or do a dilatation in all those other extremities as well.
And she'll be a great addition to the SCC as well as the community. So I cannot wait to go ahead and meet her. Dr. Pita, how are you?
I'm doing great.
I'm
How are
Eileen.
you?
Nice to meet you. Nice to meet you. I'm learning more and more about you. I want to ask you about this because with your training and your research, you do a procedure that is actually different from what we traditionally know. Is that right?
Yes. Based on my research and also a lot of publications recently, it was shown that traditional procedure, the most common coronary angiogram done in a heart disease patient, performed from the leg or the femoral artery, is associated with significant bleeding complication. But the newer approach, that's going from the radial artery to the wrist, is associated with significantly low bleeding, almost negligible. And this approach helps patients to ambulate early and also decreases length of stay and has significant cost implications to the society.
So the procedure that you do is performed through the wrist, and what happens is that patient will actually be able to go home sooner and really recover sooner. Is that right?
That's exactly.
Wow. And so let's talk about heart disease because it is very prevalent here in our community.
Yes, because of obesity, diabetes, it's increasingly becoming prevalent, and it's the #1 killer in United States, both in men and women, and even before cancer.
So this is very important information for our community here in San Antonio.
Realizing the risk factors, being vigilant, and discussing with the primary care doctor. And if you develop symptoms, not just typical chest pain, you can have nausea, vomiting, and sweating. You just have to approach physician, go to the ER, don't delay. It's better to be early than late.
Well, Maria Christina, what a wonderful lady she is. She's going to be a great addition to the team here. So let's give the folks at home some information. How can they get a hold of you?
Or Schnitzler Cardiovascular Consultants is located at 8122 Data Point, Suite 700, and our number is 210-615-0600. We have a 1-800 number, 1-800-DR-HEART, D-R-H-E-A-R-T, and our hours of operation are really Monday through Thursday from 8 to 8, on Fridays from 8 to 1:30, and we have a great website, www.sccheart.com.
Great. Thank you so much, Maria
Thank you.
Christina.